specialist gynecologist obstetrician practicing at Botshilu Private Hospital in Soshanguve in Pretoria. The topic of today is preterm labor and preterm delivery. Preterm labor is basically labor which occurs before 37 weeks, and preterm birth would be then delivery of the fetus before 37 weeks. This is quite an important topic in the sense that it's one of the leading causes of perinatal morbidity and mortality. The majority of patients who go into preterm labor, we don't get to know why they develop that. However, there are causes or factors which are associated with preterm labor, namely the history of previous preterm labor. If a person had preterm labor, she will be 2 to 3 times higher at risk of developing another preterm labor. Age, the extreme of age less than 17, more than 35. The BMI less than 18 before the person falls pregnant, and the cervical causes, and many more, like infections. Subclinical chorioamnionitis is one of the leading causes. What is labor? Labor is basically uterine contractions which lead to cervical dilatation and effacement and associated with the descent of the presenting parts. When this occurs, we should by all means try to suppress so that the baby is not born, and that should be when the fetus is fine and the mother is fine. Then we suppress. We use some medication, and during that time we give a steroid which is to enhance or speed up the process of lung maturation, and it has other benefits such as prevent intracranial hemorrhage and GIT bleeding. We do give also a neuroprotector such as magnesium sulfate. Preterm labor, when it happens, then we have some serious complications in the fetus, but the complications will be mainly depending on the gestational age at which the fetus is delivered. The more remote the fetus is to term, the higher the rate of complications. Those complications are hypoglycemia, hypothermia, infections. Infections, it's basically because of the immune system not being well developed, and jaundice, they do develop jaundice also, and the cost also. The cost is very high. Those babies, when they are delivered, then they have to be catered for in the neonatal ICU, and that the cost can run into hundreds of thousands, if not millions of rands. These are very serious conditions which are associated with preterm labor and preterm birth. Therefore, it is advised, and the success of tocolytic or suppressing preterm labor depends on the stage at which the patient presents herself to the hospital. Therefore, it would be advisable for any patient who is expectant, who has signs and symptoms of labor before term, to present as early as possible to the hospital so that he can be attended to avoid these complications. Thank you.